and welcome to today's fireside chat that is collaboratively brought to you by Unsinkable and Stepped Care Solutions. From individual story to system change, mobilizing mental health narratives across the spectrum. This conversation brings together perspectives across the storytelling spectrum, from lived experiences to systems design, to examine how narratives shape both personal healing and institutional change. Today, we will explore how individual stories shape self-understanding and community healing, how narratives inform policy care, design. I'm going to say that again because I didn't really read the commas right. How narratives inform policy, care design, and population level change. The cycle of knowledge. What happens after a story is told? How to mobilize lived experience into systems change without extraction, and why resisting a single dominant mental health narrative matters. We will be having today's discussion from three viewpoints: the individual perspective through lived experience with Joshua Bell, story for greater change through advocacy and knowledge mobilization with Hailey Hechtman, institutional perspective through system design and implementation, AnnMarie Churchill. And it is in the same order that I will be introducing our panelists. Joshua Bell, who is an unsinkable champion, a mental health advocate and community leader. Joshua brings both lived experience and national leadership to his work across organizations and initiatives. In 2025, he was awarded the King Charles III Coronation Medal for his contributions to mental health and suicide prevention in Canada. Hi, Joshua.
Hi, happy to
Thank you
be
for
here
being
today.
here. Thanks for being here. Next up is Hailey Hechtman. Hailey is the executive director of Unsinkable. She's also a mental health and social impact leader using storytelling to drive systemic change and reduce stigma. A 2025 Lead Her Award recipient, she has also received the King Charles III Coronation Medal and was named one of the Peak's Emerging Leaders for 2024. Hi, Hailey.
Hi, excited to be here.
Thank you for being here. And last but not least, AnnMarie Churchill. AnnMarie is the president and lead executive officer of Stepped Care Solutions. She brings over 30 years of clinical and systems level experiences across healthcare research and community settings. She has led the implementation of Stepped Care 2.0, including Wellness Together Canada, and specializes in trauma, anxiety, and resilience. My name is Afreina, and I am the partnerships lead at Unsinkable. I design and facilitate national conversations such as this one under Unsinkable's flagship program, Unsinkable at Work, that use storytelling as a tool for connection, stigma reduction, and systems change. And I will be your host for today. I am hosting this discussion from traditional territories of many peoples, Tiohtià:ke, which is what the Kanagahaga and now many others call Montreal. Before we dive into our discussion, if you would like to also put in your city or give your land acknowledgements in the chat box, I welcome you to do that. Also, I would like to mention that you, the audience, can leave your questions in the Q&A box at any point during this discussion, and we will be responding to these questions around 12:45 p.m. Eastern. Taylor, our operations coordinator, will be monitoring the chat and questions and sharing a list of resources at the end of the conversation. Thank you for your support, Taylor. To start the conversation, I have one question for each of our panelists. First of all, Joshua, tell us about a moment when sharing your story shifted something either for you or for someone else in a way that stayed with you.
Yeah, and thank you for the question. I'm happy to be here along some other wonderful panelists this afternoon. And for me, I'll give you a little bit of background context here first, because for me, my journey started back in 2019 after lived experience when it came to poor mental health and suicide and suicide attempts and that. A really hard time in my life, really hard time in the lives of people around me too, who were really being that structure for me and help me find resources and supports and things like that. And it wasn't until after my attempt and through conversations with other people that I started to realize that, hey, I'm not alone in this. There's other people right across my city. I'm in Hamilton. There's other people in my city, in my community that are kind of feeling the same thing, that are looking for those support systems and that. And that's when I really started to open up a little bit and share my story. I believe one of the first pieces I shared was actually with Unsinkable back in 2020 or 2021, and that sharing my experiences and lived experience journey. And it was kind of around that same time too that something started to shift, where I started to realize both with myself and with others too, that actually sharing your story holds power. Sharing your story holds experiences that only you can share in your journey with others to make them know and make them feel like they're not alone. And that's kind of what I started to realize through sharing my story and sharing some of my own experiences too, and what I think could be different with our mental health care system to improve my experiences, should those have been implemented then, but also others now. And that's something that I still see even today when I'm sharing my story, and the impact that it has on others.
Thank you, Joshua. Thanks for sharing that. My next question's for Hailey. Hailey, was there a moment in your work where you saw storytelling move beyond awareness and actually influence something bigger, whether that was a community, organization, or decision?
It's a great question. And I really had to think about it, not because there weren't examples, just because there were so many examples from throughout my career. But one of them that really stands out in my memory is when I was working in Whitehorse for Tagatha Auger. It was a local organization that supported vocational and recreational programming for adults with neurodevelopmental disabilities. And we were hosting these person-centered planning meetings, essentially an opportunity for people to come together and really gather around someone to showcase their strengths and their interests and their dreams. And one of the participants in the program, who had recently gone to a teddy bear clinic, said that she was interested in becoming a nurse. And many people assumed that that wasn't possible for her, given her her background or her presumed capacity. But we didn't believe that. We believed that there was an opportunity for her to do something that she was passionate about, that she took interest in, and so started down the path of looking at opportunities for her, which ultimately led to us proposing a partnership with the Department of Education and led us to a very big meeting in front of a group of deans at at the time, Yukon College, which is now Yukon University. And she came to that meeting. And at that meeting, at that big long table with all of these academics and people who were coming from this mindset where they may have had assumptions about this not being possible for her or particular credibility or requirements for the program as she was exploring nursing as an opportunity for her future, she had a chance to speak and share why she was interested in becoming a nurse, her desire to help other people, what that looked like for her in her future, the research that she had done. We had been sitting down and going through a number of books together. She had some virtual calls with a few nurses to learn more about their work in the field. And that presentation ultimately led them to piloting a program that would ultimately give her and other people in community the opportunity to access post-secondary education in a way that would never have been possible if I just put a selection of data points or I had shared her story on her behalf. It was the fact that it came directly from her in a room where the people of influence who were able to make those decisions could hear her perspective, could get context, could ask questions, and could see that making that decision would have such a positive impact, not only on her as an individual, but on future generations of potential students. So that's something that I always come back to is, even though it was 15 minutes of their time, it completely changed the way that people were able to access academic support and programming in that community, and continues to be a focus that they have to this day.
Wow. That just made my day, Hailey. Thank you so much for sharing that. It's a great story. I
Yeah.
want to hear the rest now, but we don't have time to go into them. Next up, AnnMarie, I'm going to ask you if you can please share a moment where lived experience or narrative directly influenced how a program or system was designed or changed.
Yeah, thanks, Afreina. That's a great story, Hailey. I'm still thinking about it. So now I've got to shift to my story. But absolutely, actually, I've seen a lot of instances where lived experience or narrative really can shift how we're thinking about system design. And I actually think it's essential. But a really good example that I'm often reminded of, because it had a really big impact on me, was during the Wellness Together Canada time. And so that was a challenging time for all of us. But that lived experience narrative, first of all, is really critical to our work at Step Care Solutions. It's a key component of our Step Care 2.0 model. And so it was really significant in the way that we were designing and developing Wellness Together Canada, which was a national virtual 24/7 mental health and substance use health platform that was for all people across Canada, that was procured by the federal government in April 2020. And we all can think back to April 2020, during those early days of COVID-19. I mean, fear and uncertainty were widespread, and the government felt we needed something for everybody in the country. And I thought of it as, what an amazing opportunity to finally do this kind of universal mental support that was open to everyone. And those are sort of the key components of our model. We really prioritize like equitable access, choice, both in how people access service, so choosing how you want to get support or help or resources, peer support, individual therapy, whatever, what you want, but how you can get it. So these were really key for us. So alongside those principles of our model was this dream of mine that one day we would have this universal mental health service, no health cards needed, no cost, no stigma, no hoops to jump through. You can just straight up get resources and support when you needed it. And that's kind of what we all felt Wellness Together Canada could be. And I was sort of going about telling everybody about this, like family, friends, colleagues. Do you know this is available? And then less than a month after our launch, and we launched really, really quickly, and trying to put all these principles together and say, here's a Step Care 2.0 based national platform. Less than a month in, I heard from a colleague, someone that I had been touting this to, and she's a therapist that I know. And she explained to me that her client, who was a drug user, went to Wellness Together Canada. She said, this is a great service, go try it out. And she was required to sign on with her name and date of birth. I'm even embarrassed as I say it, but that was sort of the setup. And there was a reason for that. I could give you all kinds of the design reasons, and to collect data and to make sure it's equitable and to make sure people could track their progress. But the story that I was being told was that this therapist and her clients, their hopes were dashed. She felt she didn't want to use it. She felt this sense of mistrust and isolation because she wasn't going to give her name and date of birth. And so this really wasn't for her. Thankfully, she also shared her perspective and her client's perspective on what was needed. Like, this is what would truly be accessible. So I took this back to our team and we started to talk about this. And really started to wrestle with the competing demands and what this story told us and what we needed to do. So the sharing of that story fundamentally changed Wellness Together Canada's sign-on process. So we actually developed multiple ways to sign on, get your data or don't get your data, get something immediate or tell a little bit about yourself. But it fundamentally helped us realize what the model was supposed to be about. And it was through the narrative in this story. The other thing it did was it exposed for us, like it really brought me back to the idea how deeply embedded structural and systemic biases are in professional and organizational defaults. We just seem to default back to them, even though I knew what we wanted to do. We were all committed to this, and we can inadvertently steer us toward the same types of systems we're trying to dismantle, despite our will to do better, despite our strong co-design models and principles of equitable person-centered care. But most importantly, this story really moved us to embed or even saturate. Like, from that moment forward, we had continuous improvement and development where we were getting feedback from service providers. We were talking to people in the community. We were constantly checking back with, is this working? What's not working? What could be made better? And it was such a learning for us how these stories and these narratives are essential for us to redesign our systems in a way that are really helpful for people.
That's an amazing story, especially like how that insight and that personal experience, the story, it just helped change something so systemic and yeah, which is maybe just not even done as thoughtfully as it should be done. Great story. Thank you, AnnMarie. Now my questions are for everybody. So whoever wants to respond can go ahead, and everybody gets a chance to be able to speak about this. So at one point, does a story move from being heard to actually changing something, whether in a person, a community, or a system? Who would like to go? Joshua, you
Jump
unmuted.
in here really quickly. And I think that the story that AnnMarie just shared is a really good example of this too, actually, because it's anyone can say after you share your story that it was a powerful journey that you went on and things like that. But it's when organizations and governments and people like at Step Care Solutions actually take your story and take your experiences and listen to it and start to shape different policies with your experiences and start to shape different avenues to deal with whatever challenges individuals might be facing. And for something like myself, who did deal with a lot of anxiety when I was younger, and even now still too, a little bit too, it's those experiences that help motivate me as well to continue to share my story in that, because we're seeing that yes, our stories are powerful, our stories are leaving an impact, but they're leaving a lasting impact, and they're leaving an impact of change on the system where we're able to take our experiences and hopefully make it better for people that need to access different resources or that want to share their story as well down the line and things like that. And I think that the example that AnnMarie just gave in her story was a great example of that, where we saw individuals with their own lived experience who were able to kind of elevate their experiences and their concerns, and change was able to be made from their journey.
I can go next, just building on that, giving space for a story to be seen through the lens of credibility is such an important part of moving a story from being, in our world, we have a lot of passive consumption of stories. We can, go online and we can read 10 of them in 10 minutes, but it's when we put them in spaces where people are going to be making decisions and we give them validity and we speak to the recommendations that are coming from that storyteller. So not just the experience that they've had, but also what could have been done differently. What can we learn from what they went through in order to be able to make more informed decisions about care or policy or supports, and see that as this invaluable evidence of what we could be doing to better someone's experience, better someone's care. Because so often we put lived experience or we put stories in a space where we don't necessarily give them the opportunity to be a catalyst for a next step, but they become that catalyst when we take the learnings, the context, the missed opportunities, the new findings or new opportunities from a story, and we actually implement them, and we play with them a little bit. We get new insights. We bring them to communities where other people are able to use that as a starting point for conversation. We use it as, not only a story in and of itself, but a tool to be able to have deeper discussion around what else is needed, what can be improved, and how we can move forward. So I feel like that's when you see the most change, is when we use story as a starting point rather than we use story as this kind of consumption point and then it ends there. So that's where I see the most opportunity for change.
Yeah, and I just want to say, I love what Joshua and Hailey just said, like this idea of the story, but then what do you do with it? And the playing around with ideas, like not just passively consuming. And what I was thinking about was, we have a thing at Step Care Solutions that we call synergy, and synergy drives change. And there's something that happens that's greater than the sum of the parts. So people can come together and hear a story, but it almost feels to me like when there's connection or empathy or alignment, like we can actually see where each other is coming from. It feels like that's where change happens. Like there was something really deep that happened to us when we heard from these people who were using this service. It's like you could imagine what they were going through and what it's like to come onto this service and how it could be improved. It was almost like we were all aligned on that something needed to happen. What it was who knows? That's where you can play around and be creative and innovative. But I think the change happens when there's connection and empathy and alignment. So this idea of synergy, where there's a real appreciation of each other's perspective and realizing that there's something in that story that we can all relate to as well.
Yeah, agreed. I think those are all just very beautiful responses. And like Hailey, I think taking what you said about story being the starting point, it leads me to my next question, which is when we talk about storytelling shaping systems, but where does that process really break down most often right now? So anybody who feels like they would like to jump in.
I can start it. Sorry.
No,
Yeah,
no, go
okay.
ahead.
I'm just going to say something quick and then maybe people can feed off it because this is something that I think we're seeing a lot of is lots of good intentions. Everybody says yes to the story and we all go, that's so powerful and that's so important. And then when we start to dive in terms of shaping systems, it's a bit about what I talked about in the Wellness Together Canada story. There's some really strong, deep-rooted structural frameworks, funding frameworks that make it tricky and difficult. And we work with a lot of organizations that really want to change their system. And I think the stories are really motivators and drivers. They all bring stories and they're very committed. And then we get into the implementation. And that's where it starts to break down. It's like, well, we can't do this because of this. We can't do that because of that. And recently someone wrote me and said, we're thinking more we can do this, but these are the things we won't be able to change because these units, it was in a hospital, these units in our hospital, we have to do this. And I thought that's so interesting. And maybe if we could open it up to, let's think about that story in terms of elements that where we could bring in change. So I think stories are great motivators and drivers and really important to ground us. And then I think it breaks down in the implementation for all kinds of structural reasons.
Yeah, that's such a great point. And I've seen that time and time again in this work, especially, we bring people in to share their story, we give them the space to do so. But if we're not prepared to explore what that story means when it comes to making changes to systems and challenging the status quo, or even being open to feedback about an organization or a process or a structure that's in place that doesn't align with the needs that the story expresses, I think that's where we often see the biggest disconnect is, oh, well, that's nice, but we have to do it this way, or this is the expectation. One of the big things that come to mind for me when I think about where it breaks down is often stories are being told through a second or third person perspective. They're being told, I go to a lot of, I'm sure you do as well, AnnMarie, you go to a lot of mental health conferences as an example, and the stories are being shared on behalf of. There's an expert on the stage. They're using stories as an example to validate their data or the research that they've done or their clinical practice. But that person, that storyteller themselves, they've often been put into a position where their story has been broken down into this tiny little, this tiny little example from a much bigger contextual experience. And rather than giving them the space to be able to provide insight and background and really speak directly to an audience, we often have someone else sharing that story, which takes away the power of it. It takes away the connection. It takes away the opportunity for us to really meaningfully learn and for us to ask questions. Because when a story is told from someone else to an audience, we get to ask questions to that second or third hand person. We're not asking questions to the person themselves. And so we miss out on some of the learning that would come from that. The other thing for me that comes to mind in the breakdown of the process is that we've often disaggregated lived experience and expertise and assume that they have to be separate. We have these are panels of people with lived experience, these are panels of people with expertise, but so often, especially in the mental health sector, people go into this field because they have a personal connection to the work. And so when we disconnect them, we assume one has some validity and the other one is a nice to have. That's often what I see is, we put a lived experience panel in a small room in the back of a conference. We put the expert on the stage. So we're automatically making a judgment call on what has value and what we should be listening to. And we're not giving, the experts who are collecting the data or exploring new tools or who are investigating new clinical practices the opportunity to be fully human and to share how this work connects to their own experience, which I think often has the biggest power. Peer-to-peer is the biggest way that we can influence change. And by assuming that someone is not a peer and putting them in a position where they have to present one way, we take away the opportunity for that story to really influence further.
I'm just going to jump in here quickly at the end, because both of what has been said so far, I completely agree with on that. And for me, there's one distinct part, because organizations are great at collecting stories and wanting to share lived experience stories and things like that. But when it comes to the actual implementation of those stories, of how can we change our systems with it, organizations often, like Hailey just said, put lived experience away from all the expertise, or they kind of use the stories as examples to validate their research and things like that. That was often said in that. There's often times where we're sharing our stories, we're sharing our lived experience and that, and then after there's kind of a dead stop end from the organizations and that too, because of integration matters or things like that. And stories start to break down then. Stories start to lose some of their meaning when they're being retold and reshaped to only validate select research or select opinions of organizations and that. And it really does break down the story and break down the lived experience for the people that are wanting to share our stories and wanting to share our own experiences within the mental health field, especially when oftentimes it is a challenge for an individual to open up and be so vulnerable in front of a group of people, especially if it is their first time or second time sharing their story with people. But that integration phase is something that a lot of organizations and a lot of groups right across the country and that too, where that breakdown, in my view, kind of starts to happen.
Yeah, agreed. I think, yes, everybody has made very pertinent points, but I think the one that really stood out to me is, Hailey, you saying that the storyteller needs to be in the room, sharing their story firsthand, and as Joshua, you echoed too, like no dilution of it, like don't dilute it, don't make like simmer it down and just give a punchline really from it, right? To use for the point you're making. That's an ideal case scenario. But my next question is really, what should happen after a story is told? What's currently missing and how that impact is communicated back to the storyteller? So I know, Hailey, for you, like I would suggest this is immediate, like it's modern age. If you can't have the storyteller, you can have their video really in the room. But until we're working towards that, let's talk about what is missing in when we don't have the storyteller in the room, and what is, how is that impact currently missing? Hailey, I'm gonna just pick you.
Sure, I can start there. And yes, people are not always able to be in the room for whatever circumstances there may be. And also there is a value add in giving people space to be able to process their story before they share it. So videos and written articles, like those are great ways for someone to process their story rather than having to be on the spot in real time. So there is a definitely some great advantages for storytellers there. What's missing in terms of how the impact is communicated, there's an opportunity for there to be more full circle communication. How is your story going to be utilized? What are we using it for? How did it impact people in the room? Being able to collect that feedback and bring it back to a storyteller so that they can see not only what did people think of your story, but what decisions were made as a result. Were there changes in perception? Were there changes in perspective? So being able to have that feedback mechanism, I think, is really critical for a storyteller. Also, when it comes to what should happen after the story, there should be an element of aftercare and support for a storyteller, especially someone who's getting up on a stage and sharing openly, or even someone who has pre-recorded a story. Once something is out there, whether it's spoken out loud in a room or it's put on the internet for other people to see, being able to ensure that that person feels ready to receive that feedback is really critical. Looking at where they are in their journey. What if someone's story is published and they receive feedback they weren't prepared for? So making sure that you are following up with someone, that you're giving them these supports in advance to know, okay, if your story is received this way, what supports can we put in place? Are there opportunities for us to have ongoing contact? What if your story changes? I think about that a lot of the time. We are always at one moment in time at any given point. And so our story evolves constantly. My story today could be very different from my story tomorrow. Are there opportunities for someone to expand on their learning, to come back and talk about what's working for them now? Can we develop these longer term relationships so that the people who are in the room experiencing that story don't have this, timestamp of someone's experience and assume that it's forever going to stay that way. The nonlinear nature of everyone's mental health, I think, is front and center in the ways in which we continue to grow and evolve both our systems and our supports for people. So those are some of the things that come to mind for me. There's a lot around co-creation that we talk about in this space. And so what does that meaningfully mean? How are they involved in deciding where the story goes, who sees it, how it's received? All of those pieces would be incredibly impactful for a storyteller and for the audience.
Absolutely. Thank you, Hailey. Yeah. Joshua, go ahead.
Jump in here too, and before because there's two things that I really think about when I think of this question. But before I do that, Kelly made a really good point when it comes to stories aren't linear and they're not time stamped at all. Like my story has changed over the last few years, especially with my work here with Unsinkable and sharing it through you guys and that, where we go through our own personal journeys and our stories are going to change. They're going to evolve, especially if organizations are really listening to our stories and wanting to make change in the spaces that we're bringing our stories and our own lived experiences to. But when I think of the question I was asked, there are really two things that come to mind: action and then feedback. So we want to know, like, what is our story going to do? What's the impact it's going to have in that? What's the action that the organizations are going to be taking with our story in that? But also feedback, like Hailey kind of said. Oftentimes we do get feedback of, hey, like your story was wonderful, it was powerful. But sometimes we do get feedback too of, hey, maybe that's not exactly what we were expecting to hear back from an audience or from a group or things like that too. Like we often hear about how impactful our stories are on the space and that, but when it comes to what happens after we share our story, we're often left in the dark. So filling us in from the organizations about what the organization is doing with our story, how it's having an impact even further outside of that event or outside of those circles after we've shared it. How can we continue to share our stories, to work together, to lift our experiences in that? And that kind of ties back into the previous question I was asked too, of where things start to break down with the storytelling system and that in organizations. But I'll end it there and pass it over to AnnMarie if she has anything else to add.
Yeah.
Thanks, Joshua. I mean, what both of you are saying really makes me think about how lived experience expertise is part of the team. So it's not over here. It's not something that we're just adding on to give a human flavor or context. It's actually part of the team. And I guess I go back to that synergy piece again, that we are stronger, our decision-making is stronger, our systems are stronger, and we have diverse perspectives. And yeah, you can have technology experts, and you can have system design experts, and you can have clinical experts, and you have to have service user experts, people who are using the service, who bring that expertise, and that's part of the team. And so what I think about on the feedback is that it is almost like a complete process where the team members are informed. We do it before we do these events or before storytelling. These are all of the things we're going to do, and this is how we're going to do it, and everybody's involved in it. And I think all the way through, if there's an impact or if there's intended impacts or if there's future processes, I just think it's really important that it's a team approach, and we all recognize that each person is bringing a really important piece to the process. And I remember, I'll just share one story because a lot of people use this story when they're talking about system change in one of the provinces we worked in. So on one of our client feedback forms on how are you experiencing the change, one person wrote this just amazing story talking about how she, for a long time, had been waiting to get service. And then the province switched to this kind of drop-in service. And her closing line in the story about how long she waited and she finally got service was her appreciation for an alternative to the assessment first, one-size-fits-all system. And she said, in the end, I was lined up for a backhoe when a shovel would have helped me along just fine. And so what she was saying was she was in this lineup for this big service when she just needed to talk to someone and could get on her way. And that was used a lot. And unfortunately, it was like this anonymous feedback survey. Can we share your story? And it was yes. And I've often wanted to be able to say to that person, it's had a lot of impact in terms of creating multiple and diverse access points for many services across the country, that not everybody has to go one pathway, that we can have multiple access points. But I was curious listening to you and Hailey, because I was thinking, how do we do that? Like, how do we do that well? And I don't know if people who are joining today have ideas is about that. But it's a question I've been asking myself for a long time. How do we communicate impact back? Because this lived experience expertise is really driving system change, and we need it. We need the underground practical. So I think it's a great question. I don't have the answer, and I think we've failed in that in many ways, and would love to have further discussions about how we do that well. But I think a team approach can help.
Thank you, AnnMarie. I think that as a storyteller, after telling my story and not hearing back really feels like setting a part of yourself free or loose into the void.
Yeah.
And you just don't hear anything. And it feels incomplete. Almost, it feels like you're hanging and you're left hanging. So I understand that it's very difficult to, like, how do we close that loop? And that's really why we're having this discussion. We may not all have the answers, but the fact that other people are thinking about it and systemically thinking about it also gives hope to storytellers to know that this isn't just something that they're siloed in and thinking about, or it's not a feeling that is only limited to themselves, but it is an understanding that as a whole, we are trying to build systems to be able to hear their story and get back to them with how it impacted people or systems. Which is going to go into the next question, which is, what does it actually look like to bring lived experience into decision making without extracting from the person sharing it? So I know we've touched a bit on this, but if we can really just pointedly go into how do we make sure this person isn't a demographic, that they stay a person, a story, a human afterwards. Go for it, Josh.
Jump in here quickly right away at the start here and that. When we're sharing our story with people, oftentimes in these rooms of policymakers or with organizations like Unsinkable and that too, we want to be part of the discussion in that. We want to be part of the actions that come afterwards. We want to be part of the creative actions journey and that, and seeing how our story actually has an impact in that. And part of that, especially when it comes to the decision maker side of things, or like the after we share our story, what actually happens is not just reducing our story to a data point, not just reducing our story to 2 or 3 examples of what we've shared. It's actually letting us share and create our own space where we feel comfortable and other people in the room feel comfortable to be involved in our story, where people are actively listening, wanting to learn more, but they're listening and comprehending what we're actually saying. They're listening and wanting to take back what we're saying to their own circles, to their own organizations, and sharing it fully, and even inviting us to some of those other conversations later on too, where we're again able to share those stories with people on that. So it's not reducing us to a data point, not reducing our stories to just examples and stripping it of that personality, because these are people's personal journeys, these are people's personal experiences, and these are oftentimes, like I've said before, very vulnerable experiences for some people, especially for some people who have been in care for a long time or who do need additional supporting care throughout our healthcare system. But I'll keep my answer short, simple, straight to my one point in that, and I'll pass it off to Hailey or AnnMarie.
Thank you, and I do appreciate you keeping it concise because we're like almost nearing the end. We have some very few questions left, but let's try to keep it there. Go ahead, Hailey.
Sure, thanks, Joshua. Just building on that, there's a number of ways I feel like we can create this support mechanism that isn't extractive. And I think one of the main points that I wanted to bring forward is the importance of taking a strength-based approach to how we bring those stories into these spaces. Oftentimes, stories are brought for an example of struggle, or are meant to showcase the value of an organization's input or services. I think about, there was a comment, I think AnnMarie made this earlier, around impact storytelling. So many organizations are in a position where they need to demonstrate their impact, and they do so by bringing someone's story forward and showcasing it as a center point to why their services are important or why they've brought value, which is fine. It's not to say that we're not able to do that, but it often takes away the dynamic of someone else's full experience as a human person. And so making sure that when we're bringing those stories forward, we're showcasing the strength, the resilience, the agency that that person has, bringing them into the room, like Joshua said. But if we're not able to do that, what are the ways in which we can make sure that their story is told from a perspective that recognizes their full humanity? It doesn't put them in a box and say, well, this is a story of someone's experience with this diagnosis or from this particular community, and segments them in a way that they're only being seen through that one lens. It's about recognizing the full scope of their human experience and encouraging people to see themselves back through that story. One way that stories have the greatest influence and we reduce the amount of extraction that could possibly happen from someone's story is when we put ourselves in their shoes, is when we actually use it as a way of mirroring back our own lived experience through the lens of that person's story. So that rather than seeing this as a separate, oh, this is them, this is us, it's how do I use this as a way of reflecting on my lived experience, my perspectives, the times that I've been in this situation. That's what gives us that human connection. And that's what makes a story not only powerful, but also gives it that lens of credibility that if this person has been through this, there's something that I can personally see myself in. And that gives them that human complexity that every storyteller deserves when we put their story forward.
Yeah, I don't know if I have a few seconds to jump in on this one, but I did. Do I? Okay, great. Because there's something in this that I think is a really important question. So thanks, Afreina, for asking that. Because I think we do get it wrong. I think we do silo stories, and often they're presented as absolutes and uncontextualized. And I do think that's to support existing or identified projects rather than, I think the opportunity for stories and that we could do better with is help with the process of solutioning. So not after the fact, but actually stories can, I really think, and when we've have lots of stories and narratives and feedback, it really helps to identify opportunities to reach goals in our system change. Like often these stories highlight areas for opportunity, also areas that will detract from our intended goals and outcomes, like with WTC. If I didn't have that story, we would have been off track. So it's not so much to promote or to use that a data point. I actually think we're missing the opportunity to have this expertise, these stories as real opportunity and information to help us to find better solutions. So they're part of the process. So I guess that embedding again into the process.
Thank you, AnnMarie. I think you really nailed it on the head with that one right there, saying that this is how stories are so integral towards changing systems and processes, and we need to make them more centered towards those. Okay, last group question, and everybody who's watching, there is a Q&A box if you want to put your questions in. If it's for any one panelist, mention their name. If it's for anyone and everyone, just go ahead and put it in, please. We'll be coming to the Q&A box shortly. So what is one thing individuals, organizations, or systems consistently get wrong when trying to use storytelling to create change? It's like a devil's advocate question.
I can go. I have a very quick answer to this question. There's many things that they get wrong, but one of the biggest ones that I see is that the problem is at the center versus the solution. Like AnnMarie was saying, that we use a story to further punctuate a problem and speak to, okay, here's what's going wrong, versus how do I use a story from a position of action and mobilization? How do I gain insight from a storyteller, their experience of the systems that we work with in the organizations? That feedback is such important data for us to be able to make better decisions, create better solutions, create better systems. And so when the story is used within the context of explaining a problem rather than as a tool for creating opportunities to discuss potential new ideas and solutions moving forward, that's when the change doesn't happen, because we're not focused on the change. We're focused on what is going wrong.
just going to jump in here quickly too, because I fully agree with what Hailey was saying. That's kind of similar to what I was going to say. But the second thing that I was also going to say, which we kind of talked about previously a little bit too already, was that stories aren't linear. Stories do change. Stories continue to change. And there is a little bit of a disconnect right now, I feel, at least sharing my story with organizations and that too, of organizations not understanding that sometimes, not understanding that stories change, stories evolve, and people evolve, people change as well. So that's just something else that I would want to highlight during this question, in addition to what Hailey just kind of said.
Thanks, Joshua. AnnMarie, would you want to chime in?
I'm just going to say ditto to both what Hailey and Joshua said. Thanks.
Got it. Awesome. Okay, so while we're waiting for any questions to show up in the box, I am going to be closing this panel discussion by once again asking a pointed question from each and every one of you, and starting again from you, Joshua. So for someone who is considering sharing their story or has already shared it, what is one thing they should hold on to or be mindful of as they navigate that process?
Don't rush telling your story. Take your time to fully understand what you've gone through and fully what you've experienced in that, and take time to formulate your story. Take time to understand how you want to share it, where you want to share it, who you want to share it with, and don't rush telling your story. People's stories, like we've talked about throughout this conversation today, they hold power and they're able to change the system. And when myself or others take time to share our own lived experience stories or share our experiences when it comes to some of that change that happens after we've shared our stories, it only becomes more impactful. Take time to really think about what you want to share and how you want to share it, because it does have an impact.
Thank you. I love that advice. Hailey, for organizations working with lived experience, what is one shift they can make immediately to do this work more responsibly and effectively?
I would say the one shift is really looking at someone's readiness. Where are they in their journey? How much of their story have they processed? We talk a lot about being able to share your story from a wound versus from a scar. If someone is still trying to work through some of the challenges that they're navigating, or haven't fully had the time to think about, process, sit with their experience, it can be a really daunting and difficult position to be in when you're trying to share that story publicly or in an intimate room or to try to influence decisions. So giving them support, giving them space to be able to see where they're at in their journey, what they're ready to share, what they're not ready to share, what they're ready to get feedback on, what they're not ready to get feedback on, really sitting with someone and not assuming just because someone comes forward saying they want to share their story that they're ready, giving them that encouragement, that space, that support, that time, like Joshua said, to be able to get to a place where they feel most confident sharing their story, because that's when the biggest powerful nuggets are going to come out, is when they feel confident, supported, empowered, and ready.
Thank you. AnnMarie, for people working within systems, healthcare, policy, leadership, what is one practical way they can start integrating lived experience into how decisions are made?
Thanks for that question. The first thing that strikes me is I think most organizations would say they are doing that. And when we meet with them to do system design or implementation, they will agree that they need to integrate lived experience. So I think that's well understood, that lived experience perspectives are essential to ground decision making. I think that's understood. And also, I think we all recognize that if we make decisions without lived experience expertise, we're not doing it with people, that it'll be flawed and it won't be successful or sustainable. And when we bring those issues up, people generally agree with that. However, there still seems to be a challenge with the integration in decision making and system design and planning and those sorts of things. So practically, I'm going to say two things. One that came out of today that I think is really critical is including lived experience, expertise, storytelling as part of the team. And this will be essential for expertise for innovation and solution finding in your decision making. So I think as part of the team is critical. And the other one that we're seeing a lot is that people don't have compensation frameworks. And I think all organizations need to start to think about and develop. Some do, and we actually take those and provide templates for other organizations to build on that. But I think we really need to see this as expertise and critical pieces of our organizations and decision making and system design teams. And so this idea of a compensation framework, some people call it honorariums, but it's really essential to recognize the expertise and to ensure this safe and equitable participation.
Yeah, thank you. Thank you so much. We have a question from our audience. This is Leanne, who's asking, how do we buffer the ripple effect a story affect people you are connected to? It's open to everybody, so whoever wants to go.
I can just jump in here quickly to answer it, and please feel free to type in the chat and correct me if I'm not understanding the question correctly at all. But kind of going back to my own lived experience and my own journey, and that a lot of the people that were close friends, close family, and that in that close circle that might have been affected by that ripple from me sharing my story were often involved in the support system when I was going through those journeys. They were often involved in helping to look for places of care, look for just being that voice, or sorry, being that person to listen to my voice during those challenging times. And when it came to me wanting to start to share my journey, wanting to start to share my experiences with people, they were often some of the first people that wanted to make sure that it was a safe space to do so, that I was fully ready to do so, and that too. So they were understanding of it. When it comes to the ripple effect, though, we also need to ensure, we've talked a lot today about lived experience, a lot about sharing our stories and that, not so much about the caregivers and the other people that are part of our system, especially for people like myself who do have that lived experience with suicide and with poor mental health previously and things like that. We need to ensure that there are support systems in place for those people around us, whether they be family, whether they be friends, or just the people that are lending a hand and listening to us share our journeys as we're going through it. And that includes into the post-vention phases. As we start to share our stories publicly to change the system. We want to ensure that everyone feels safe as we're sharing our story, especially those that were most close to us in supporting us through that journey and ensuring that we kind of made it out on the other end.
Thank you, Joshua. Does anybody want to chime in? I think that was a pretty well-responded answer to. All right. So I'm going to start, because we don't have any more questions. I'm going to start to wrap up our conversation. And essentially, what I'm hearing across all of you is that stories don't end when they're told. They begin a process. And the question is how our systems, organizations, and communities are now building towards carrying them forward. Today's conversation is part of Unsinkable at Work's a flagship program of Unsinkable. And we don't want you, our audience, to leave this conversation without next steps for yourself. So I'm quickly going to be attaching a resource kit that we've made for you. It should be uploading and sending pretty soon. This is, so essentially, if right after this conversation you want to jump onto page 9, you will find a short exercise for yourself. Page 13 has my contact information if you would want to have a similar conversation in your organization. And pages 4 to 8 point you towards resources depending on your situation and what you're looking for. Before we end this discussion, I want to thank the many people who made today's event possible in no particular order. Jerusha, Mike, and Taylor from the Unsinkable team, and Leora and Jeff from the Stepped Care Solutions team. On that note, I would like to thank you, our esteemed panelists, and you, our audience, for coming out today and attending. The recording of this talk will be sent to you today. And when we end this conversation, a small survey will pop up. It really doesn't take a whole minute even. So if you could please fill that out, we'd be very grateful to you. Thank you, everybody, for joining.